Good afternoon, everyone. Welcome to session 7 of the Marketing Moments webinar series. I can't believe that we've done this 6 times and doing our 7th. Today's session is going to be leveraging long-term care insurance for home care growth. My name is Julio Barea, Vice President of Sales for Care Time, and this is a very good subject for me. One of the things that our cost software company does well is work with long-term care insurance companies. But before I get started on that, I want to introduce the most important person on this call, Debbie Miller, my longtime friend and partner, owner, founder of 52 Weeks Marketing, and runs Senior Helpers in Nashville. Good afternoon, Debbie. How are you doing today?
I am doing fantastic. I was so excited to hear how many people we had registered for today.
Can you believe it? I believe there's over 220 people. And folks, those of you who have joined the webinar, thank you, and thank you again. You have made this our most attended and registered webinar to date. Not that there's any pressure for you, Debbie, in having to speak to so many people.
I'll do my best.
All right. So before we get started, let's jump in and talk about what we're doing next. Our very next class is going to be on November 13th, talking about diversifying your payer sources to increase revenue. And part of this is going to cover things like payer source diversification, which, as you folks know, if you want to make sure you continue to get paid in an ever-changing market where regulations will change or market conditions will change, you've got to make sure you're not over-dependent on one payer source. The other thing you have to do, we're going to have an overview of what those payer sources are versus long-term care insurance, which we'll talk about today, or I'm sure Debbie's going to talk about private care, private pay. We'll probably talk about things like Medicaid, maybe what might be in there. So there's a lot of different payer sources to grow your business. We're also going to talk about tapping into partnerships. And partnerships are how you're going to capitalize on those payer source opportunities. That is, who do you work with that can drive you particular payer sources as referrals to help you build that business? So Debbie, I'm excited about this one too. This is a great subject.
You're always excited.
I know, I live in excitement. Don't worry about it. Okay. So learning objectives for today. We're going to learn how long-term care insurance can increase your agency's revenue. This is important. There's a lot of long-term care insurance out there. There's a lot of people who don't know how to do long-term care insurance, which is why Debbie's talking about it today. There are a lot of nuances and ins and outs about long-term care insurance policies. And she's going to show you how to have some marketing ideas to position yourself as a long-term care insurance specialist. And I want to remind everyone, when you're working with long-term care insurance, it is important that you work with a software partner that can handle some of those nuances of long-term care insurance. And I do have to say that Care Time is one of those partners. So I'm curious to see the answers to this question. How would you describe your comfort level and understanding of long-term care insurance policies? I want to know if people are very comfortable. I want to know if people are competent but could learn more. And I want to know if you don't feel competent or comfortable at all. And let's see what these answers tell us. We have a lot of people who feel they are competent, Debbie, but could learn more. 57%. 27%, 28% aren't competent or not comfortable, and 14% are very comfortable. That's a good mix. I think this will give you sounds like we have a lot of background and baseline information for people to learn from. So thank you folks for doing that poll.
That's awesome.
I'm sorry, go ahead. Let's flip on to the next slide. So Debbie, I'm going to turn it over to you. They didn't come here to see me. They came over here to see you.
Well, I appreciate all you do and all the work that your team is doing behind the scenes to make these events possible. So awesome job. And thank you, Julio. We are going to unlock this huge opportunity. Sounds like some of you are feeling competent, but hopefully I'm going to be able to share some information that you'll be able to utilize. Definitely around the marketing ideas. I think there's going to be some awesome tips and tricks that you can utilize. As Julio said, I am the founder and CEO of 52 Weeks, but I'm also a home care provider. And I was actually out in the field today. I did a presentation because my marketer is off today. And so we had some important meetings this week that I'm covering for her. And so I was out there talking about long-term care to a home health and hospice company. And so I just want you to know that everything that I'm going to be talking about are a lot of the things that I've learned over the years since I started the business in 2008. Tons that I've learned, processes that I've been able to incorporate. And to Julio's point earlier, that we really do want to diversify. and be able to accept as many payer sources as possible to expand our reach, to build our client base, and ultimately to increase our revenues. At the end of the day, fewer and fewer people are able to afford care. That's just the reality of the situation, right? We have seen a huge increase in the cost of services. When I first started, we were $16 an hour. We're now $33 an hour. So what does that mean to the senior? Hey, fewer people can afford it. And what we're seeing, and we're seeing this over the whole industry, the number of hours are decreasing. So, where somebody maybe could afford 8 hours a day are now going with 6 or 4 hours. So that has definitely impacted on a lot of folks in the revenue. So we want to take advantage of the opportunity that long-term care will provide to us, because as you can see here, this is Genworth's cost of long-term care, their survey they do every year. 2023, you see the cost there, and then what they're projecting in 2033. So again, if we're able to capitalize on all those payer sources, we're going to be in a better position for the future, right? Now, when we look at long-term care specifically, huge opportunity, you all. There are 8 million long-term care policies in America right now. I was actually talking to Genworth at CareScout, amazing contact that I have there at CareScout. And I learned that there are 23,000 policies, just Genworth policies in Tennessee. So I'm going after them, and I'll show you some of the things that I'm doing. But here's what I want you to understand. Only 300,000 policies are actually activated. So there are a lot of opportunity, but the reason that so few are activated is because very few people understand how to utilize their policy specifically for home care. So we're going to look at that and how we can capitalize on that. So ultimately, you want to be very intentional, right? What the plans you put in place today are going to affect you tomorrow. All right. So if you maybe watch this webinar, and by the way, I'm only going to be able to scratch the surface today. There is a lot to learn. I'm going to share with you, what I've learned over however many years in 45 minutes or less is my job here. So there's a lot more beyond this. This is hopefully going to get you very interested to say, hey, I need to be doing more. What else can I learn? So I want to share with you where my business has gone, okay? And I always like to put my money where my mouth is, and share with you what we're doing and then how it's impacted my business. So in 2017, I wasn't really spending a lot of time or effort focusing on long-term care, but around that time, we had just under $1 million in revenue related to long-term care policies, okay? Then I started to get to better understanding. There is this, incredible opportunity. I learned that a lot of people don't take advantage of the policies, die before they ever activate the policy. Horrendous. And so I started to really put some effort into it. And so 2018, you see the increase there. And then from 2018 to 2019, I was adding on more than $500,000 every year. And look at where I went from 2019 to 2020. And then in 2021 and 2022, we had the pandemic, which really stunted what I was able to do out in the field as far as promotion goes. But what's interesting here is we maintained those patients. We still had some growth because obviously we always have that natural attrition. People die in our business, but I had enough to support it to maintain that revenue. So that's one of the things that I want to help and highlight here is that these cases tend to be longer hours and they stay with you a while because they're sustained through this payer source. All right, they're not there. So that's really, really important. So then we basically turned the faucet back on, got out there, started to do some marketing again. And you can see where we are right now in 2024 is $3.2 million in just long-term care business. All right, so big opportunity. Many of you aren't even doing that in your general revenues. And so this could be something where you could really hang your hat on and focus on 2025. But you've got to make the decision today and put the plans in place. So lots of challenges out there, okay? But I want to share that these challenges create some opportunities for you. The number one challenge is that seniors who bought their policies a long time ago don't really understand what they have and how to use it, okay? And so that's why you see only 300,000 policies activated. The other thing is families aren't aware of the benefits that their loved ones have. So educating families is going to be a big part of this. Healthcare professionals, financial advisors, even long-term care insurance agencies don't understand how to help their clients and certainly how to help their patients activate those policies to help pay for care. All right. Communities don't have trained experts out there to advocate for policyholders and again, to help them activate those policies. So there are a lot of people that get denied or delayed because they don't have anybody supporting them and helping them through this process. So you can be the expert here. You don't want to refer out, you want to own this one. All right. So what does that mean? You're going to have to understand how to read a policy and capitalize on the benefits. Okay. You're going to have to be able to make recommendations based on the nuances within the policies. So there are a lot of different bells and whistles and things that you want to understand and be able to position that strategically to guide your patient and their family. You want to partner with those long-term care insurance companies. Make sure you're doing everything you can on your end, compliance-wise, so that your client gets paid, gets reimbursed according to their policy. And then finally, market your expertise. Get out there and tell the world that you are an expert at this. And so they want to refer to you to help their patients. And then mobilize your referral partners to seek out policyholders. All right. So let me explain that. I was just doing a presentation yesterday with 7 social workers at a skilled nursing facility, the rehab facility. Okay. So they discharge a lot of folks. And I specifically was honing in on at admissions. Ask these people, do you have a long-term care policy? Change your workflow. This has to be part, and they totally got it. They're like, oh my gosh. Because I said, if you make a referral as soon as they arrive, we're going to be able to help them understand their policy, tap into and to understand exactly all the nuances, what the elimination period, put all those plans in place so that when they discharge, we're ready to go. The policy is already activated and their care is going to be paid for. So I'm out there, these are the things that we'll be talking about from a marketing perspective. All right, so what do you need to be able to answer? These are questions on everybody's mind, including policyholders. Should I keep my policy? These are expensive. Sometimes they're up to $800 a month, the premiums. And so they wonder, should I keep doing this? So you want to be able to help them and guide them, because a lot of these long-term care insurance companies are giving them offers. I'll buy you out for $40,000, or we can stop your premium increases if we take away the inflation rider, as an example. So a lot of these people will do these, not real, and of course they're getting older, right? As they get closer to the time where they could actually activate the policy, they get all these deals. They're wheeling and dealing with them. So we want to encourage them they've got an amazing benefit here, hang on to it. They want to know when they're going to be eligible to activate the policy. How difficult is it to qualify for benefits? A lot of confusion about that. What types of care and services will the policy cover? Is cognitive decline an acceptable trigger to activate the policy? And then what can they do to ensure that they don't get delayed and denied? We're going to talk about that today. And then, of course, they're wondering what kind of advocacy and support's available. That's where you're going to position yourself. All right, I want to start by dispelling some of these myths. Okay, and one of the major misconceptions out there is if I start my policy, I'm going to run out of money. That keeps a lot of people from actually activating their policy. Here are the statistics. 50% of policyholders will die before they ever take advantage of any benefits. Part of that is because they think they have to be very incapacitated. I'll talk about that in a minute. Of the people that do activate their policy, 70% of them will die before the policy runs out of money. All right, so what does this tell us? This tells us that people are waiting too long to activate their policies. And we know this from the statistics, right? We know when you just look at the number of people that end up in the ER, all right, there are 29 million people over the age of 60. And as you can see from this bar chart, this increases with age. So you've got many, many people going to the hospital ER, and often because they're not getting the care that they need at home. In fact, we see this common pattern. I call it hospital, rehab, home, repeat. Hospital, rehab, home, repeat. I just said this to date in a meeting that I did, and as well as with the social workers, and they're all nodding like, yeah, we see it. And yet every single healthcare organization is focused on reducing readmissions, right? Why isn't it happening? Because they have no control over what happens in the home, which is where most of the issues happen that send people back into the hospital. And yet 76% of readmissions are preventable. And so getting that help, getting our services, getting that home care can really help reduce readmissions. And these are the key messages you want to be delivering when you're out there talking about how long-term care insurance can help that facility reduce readmissions. Another misconception: well, I'm not sick enough for my policy to pay for my benefits, or my husband's taking care of me, or my wife's taking care of me right now. All right, well, here are some statistics. You heard me say there are 8 million policies, all right, and only 300 are activated. The problem is people think they have to be bedbound. They think they need 24-hour care before they can utilize their long-term care insurance benefits. All right, but here is statistically, the bar is a lot lower than you think to activate the policy. I'm going to go through that. Statistically, 4 million people in America would actually qualify to activate the policy. They need assistance with their ADLs, or they have cognitive decline and they don't even know it. And so this is a big opportunity for us, but it's going to take us getting out there and educating folks, right? Because knowledge equals power. And so I'm going to share some basic information that you want to be aware of as you get out there and position yourself as the expert. So the first thing is we want to know is what type of policy our client has, okay? There are two types of policies that you want to be aware of. The first one is an indemnity policy. And these policies are like an annuity, okay? So they pay the stated maximum amount, regardless of the cost of care. So in the policy, there will always be a maximum daily amount. They're all different. Every policy is different, even between husband and wife. It's unbelievable. All the different nuances. It's very specific and very individualized. All right, so you'll in this indemnity type of policy, say, for example, the care costs $100. It's $100 worth of care, but the maximum daily amount will provide for $150. They get $150. And so they get to pocket the extra $50. So they're going to pay you your $100 for the care, but that now they're pocketing the extra $50. So what's nice about this is they can actually accumulate a nice little cash reserve. Important point, right? When you're helping, guiding folks and being strategic about what you learn in the policy, how to use that strategically for their long-term care planning. The next type of policy is a reimbursement policy. And this is the most common type of policy that we see. And basically what this does is it reimburses you for the care to the maximum daily amount, but you have to show proof of care. All right. So if your daily amount is if your care is $100, all right, and say your daily allowance is $150, but your care is $100, you're only going to be reimbursed for $100. In this case, the insurance company pockets the extra money. Okay, so you have to prove to your maximum amount, and then that's where we can come in also as a provider, is helping them with those timesheets and things, all the paperwork that they need, or the EVV records or whatever that they need to be supplying, that we can be doing that on their behalf. All right. The next thing to understand is, what does the policy cover? And there are several coverage variations, and each policy is different, as I said. So it's important to understand this. So the first policy, some policies are written that where they will only cover the cost of home care or assisted. Some will only cover nursing homes. All right, sometimes these policies are so old, we didn't really have home care or assisted living. It wasn't popular the way it is today. Sometimes you can make an argument for that, and it's worth really pushing the company on that. Sometimes they will acquiesce, sometimes they won't. All right, so that's important to understand. But in many, many policies, this is very common where they will have a combination. It'll be written, it could be home care, nursing care, or assisted living, and they'll just accept either one of those. All right, some additional coverage. These are the bells and whistles included in the policies. And by the way, I want you to really understand this. When the client calls the insurance company, they don't say, oh, Mrs. Jones, by the way, you also have a benefit to cover durable medical equipment or homemaker services, or so none of those things. So that's where we can help them to really tease out some of these nuances. And this can be hugely beneficial to your clients. And I'll give you a quick example. We have a service where we actually review the policy with our clients, and we actually get on the phone with the long-term care insurance, and we've got a whole process for that. In one of these calls, we determined that this client had $35,000 benefit for home modifications. Now, in this particular situation, this man, the husband that I was working with, his wife had Alzheimer's disease, okay? And he had been doing 24-hour care for 2 years by the time we got involved. He had been so frustrated that he was paying these huge premiums. He was really struggling to get through this whole process with the insurance company, blah, blah, blah. What happened was he has 2 9-year-old, they're twin boys, grandsons that live in the house. He did not want to have to move his wife down they were going to have to convert the dining room into a bedroom. He didn't want to do that because the kids have the run of the house. He loved having his separate little quarters with his wife upstairs, but it was getting too difficult for her to go up the stairs anymore. So when we presented this and said, oh my gosh, you have 35,000 in home mods, we were able to get him and installed well, we didn't install, but we made a referral and got him a phone or a chair lift, totally paid for by the insurance company, that he would absolutely have had no understanding of. So these are the kinds of things that when you know and you can present this, and I tell you, this client, let me tell you this situation. We took care of his wife for 5 years. She passed away about 6 months ago. We're now caring for him. And he too had a policy. The loyalty that this kind of work brings you, they love you. They feel so appreciative. So lots of things there to dig through and to really tease out and understand so that you can guide that family. All right, so let's talk about how a lot of policies are characterized in terms of their benefits. Okay, this is really important when we're planning, helping our families plan their long-term care strategies. So 3 different variations. The first one is a finite bucket of dollars. So this is like a bank account, right? And the policy will say, you've got $400,000 in your policy. And that basically will allow you to spend up to $400,000, but they will still always include a maximum daily amount. So, you don't get to get a check for $400,000. It's until that money is gone, but it's still going to pay you, say, $150 a day, whatever's written in the policy. Important to understand. The next thing is a defined period of time. All right. So this is basically saying that we're going to pay you whatever the maximum daily amount is for a period of time. Sometimes it's 5 years, sometimes it's 2 years. Really important that your clients understand that you can't stretch this. All right. Sometimes people will approach this and say, okay, well, I'm going to, instead of taking 8 hours of care, I'm going to go with 4 hours of care, and then I'll get 10 years instead of 5 years. It doesn't work that way. They'll be leaving dollars on the table. All right. So it's really important that you take the way that policy is written, very seriously. All right. The next variation is lifetime dollar per day amount. All right. And when I say lifetime, I mean as long as that person lives. We see a lot of these policies. These are a lot of the Genworth policies or John Hancock policies that were written like in the 80s and 90s. You're seeing a lot of those. So this is fantastic. So what does this mean? Whatever that daily amount is, and by the way, a lot of these policies have an inflation rider. So even though the policy might say $300 a day, if it has an inflation rider, you've got to call and say, all right, what are we at for a daily amount now? And it might be $400. All right, so that's a really important point that you want to tease out as well. All right, so in this particular case, it's going to be whatever the maximum daily amount is for their lifetime. So this is an amazing, stable business for you. You're going to have them as long as they live. All right, so that's one of the huge benefits of really going after this. So understanding these variations going to help you, help your family, help your clients plan their long-term care strategies. Okay, let's talk about elimination period. This is also really important in terms of planning. All right, so what is this? This is that predetermined period of time where they have to be paying for care, and then their policy will kick in and start to pay for the benefits, okay, to that maximum daily amount. So this is what they're responsible for. It's kind of like your deductible in your auto insurance. Same kind of deal. You've got to pay that upfront amount, and then the insurance will cover. So so there are, again, a lot of variations in how these are written. Oh my goodness, I'll talk you through that. So this is just that elimination period. So let me talk about some of those things, because this is important to understand how the policy defines the elimination period. Okay, so some policies will have a unique definition where they say 1 day of care is 1 day of elimination. Some policies will say 1 day of care is worth 3 days of elimination. Some policies will say 1 day of care equals 7 days of elimination. Now, people don't understand this, okay? And I'll give you an example. We had a man who was caring for his wife who had mild to moderate dementia, okay? But he was getting to the point where he couldn't really leave her alone anymore. He had a 365-day elimination period. What he didn't know is the way it was defined is 1 day of care equals 7 days of elimination. So when we did the assessment, and what his issue was is he just wanted to have a little break. He was no longer able to go golfing with the guys. So he was just looking for a little bit of break. Okay. So we go to do the assessment. And so we got talking about his policy, and he goes, well, no, I don't want to activate the policy yet. Again, I'm afraid I'm going to run out of money. And I've got a 365-day elimination period. So I don't want to do it until I really need it. And so when we helped him and really went through that, we said, whoa, wait a minute. Every day of care, the way your policy is written, is equal to 7 days of elimination. So here's what you should do. Let's set your wife up for 1 day a week for 4 hours. That gets you to be able to go out and golf with your buddies. And you, in 1 year period of doing this because remember, 7 days, so you have 52 weeks, no pun intended. Right there, we've got, in 1 year, he was going to be through his elimination period, which we know dementia is a progressive disease. As more time goes on, they're going to need more assistance. So by the time she really needed more hands-on care, he was through his elimination period. And so those are the kinds of benefits. By knowing this stuff, you're going to be able to help your clients through this, okay? And man, you talk about having an amazing relationship with this man and caring for his wife now. It's just amazing. All right. So some of the things that you want to also think about is when you're strategizing, say you're working with an assisted living facility, okay? And they've got some folks that are considering going into the assisted living facility, and they've got a long-term care policy. You might want to recommend, look, to help them get through that elimination period, we can provide care for them at home. It's going to be a little bit cheaper. Maybe we just do 4 hours a day to assist while they're banging through that elimination period. And then once they're through that, you take them into assisted living, and we can, their plan is going to cover the cost of the assisted living facility. So for example, if somebody with a 90-day, say, elimination period moved right into the assisted living facility, and it's $5,000 a month, okay, that's kind of on the low end these days, but $5,000 a month. They move in and it's the 90-day, they're paying $5,000 a month. That will cost them $15,000 that they're going to pay out of pocket to get through that elimination period. If we kept them at home and say provided 4 hours of care, that's a lot less out of pocket funds for them. as they bang through their elimination period. And once they do that, they move into assisted living, and now the policy is covering that. So that's a recommendation that you can do. They can definitely, if you are able to do a few hours a day, that can be very beneficial. We had a client that we started during COVID. All right. This is a husband and wife. They both had policies. They both had the ability to get 8 hours of care, but they had a 90-day elimination period, each one of them. Okay. So what we did, activated both policies. We did 2 hours of care for each of them, so that they were getting 4 hours of care. In that particular time frame, the daughter was able to work from home because of COVID. So she provided the additional care. After 90 days, to this day, we provide each of them 8 hours of care. So they get 16 hours of care with a caregiver for both of them. And so that was a way that we were able to help them through that elimination period. So if you have a 4-hour minimum as an example, you may want to lower that if it's going to help somebody economize through the elimination period. Take 2 hours because you know it's going to end in an 8-hour case that could last years. So those kinds of things you want to be thinking about. All right, what are policy triggers? And what I mean by this is, what are the things that are going to enable somebody to activate that policy? These is the criteria to help them qualify. All right. And so 2 ways to qualify typically. They need assistance with their activities of daily living, and most policies are written so that it's at least 2 activities of daily living. Or they require supervision because of cognitive impairment. All right. So those are typically how we get somebody that will be able to qualify. All right. Now, in understanding, again, some of the specifics, all right, when we look at the assistance with activities of daily living, the policy can be written one of 2 ways. It can say hands-on assistance with activities of daily living, or standby assistance with activities of daily living. Some policies say either or, and that's wonderful. Very important for you to know this and ensure that when you write the care plan, it mirrors what the criteria is. This is how people can get denied or delayed if your care plan does not match the criteria. All right. Now, this is one thing I want you to understand. If you look at all of the $3.2 million in long-term care revenue right now, 70% of those policies said standby assist. Standby assist. So when I said the bar is a lot lower to activate these policies, that's something you want to be out there communicating and educating, particularly your referral sources. They don't know this. All right. So standby assist is sufficient. So what's the difference? Hands-on obviously is kind of self-explanatory. These are where the health circumstances dictates that they actually need someone to put hands on them to accomplish that task. Bathing, you have to be actually washing them. Standby is you've got to be within arm reach to keep them safe from a fall, that kind of thing. All right. So again, understanding how it's written, really, really important. All right. So let's look at cognitive impairment. And this can be a trigger to activate a policy. And the standard wording in most policies states that they've got to suffer from severe cognitive impairment in order to trigger the policy. All right. So now a lot of the standards are related to what the state law has. Okay. In Tennessee, it says cognitive impairment must be such that you are at risk of harm to yourself or others. So this could be, man, if there's not somebody supervising them. And here's the thing that we sometimes come against. They can do their ADLs, they're strong enough, but they can't do it without cueing or supervision. So this is a very important trigger, and the one that we want to be aware of, because we don't want them to be limited because they can do their ADLs, but they can't do them if somebody's not telling them or showing them how to do it. So really, and typically most insurance companies will require a doctor confirmation of a diagnosis. All right. Now, the premium increases are something that you're going to hear your folks talk about. Some of them are going up 50 to 100%. All right. And so this is important that we, understand that and help them understand, look, when you activate your policy, that premium goes away. That man that I was telling you was so frustrated about the premiums. He was actually even considered, because he wasn't able to deal with the insurance company. By the way, he had really bad hearing, so he could never understand what they were saying. It's terrible. So we really came alongside him and advocated through that whole process. And so what we learned there in that situation was that when we were able to tell him that $800 that you complain about goes away when we activate the policy, he was so happy. And then he's getting the care that he needs. All right, so some things that you want to ensure that your clients know to avoid these issues. They've got to have a power of attorney, and that power of attorney needs to be mailed to the insurance company. All right, that's really important. Otherwise, their family is going to really struggle to get this off the ground. You want to know how to review that policy with them because they need an understanding of that. They want to get assessed and make sure that they know when they can start care. Don't wait too long. Okay. And then finally, ensuring that the care plan supports the requirements. So this is where you can really own this. You can own this market, guys, and be out there positioning yourselves as the experts, helping your families make sure that they get to use this policy. All right. So all those challenges that I talked about, man, by being the expert, you can educate policyholders and their families, help them activate their policies. You could train your referrals and healthcare professionals about the benefits like I did yesterday with those social workers. You can encourage your referrers to identify the patients at intake and get you in the door before they discharge. It's a great way to ask for the business and definitely differentiates you from your competition. And then finally, educate the community and market your expertise in long-term care insurance advocacy. All right. So you want to let your clients know this is like just some simple things, bullets that you can add to a follow-up email if you've done an assessment or something you could say. Hey, we do a policy review and strategic planning with you. We do advocacy phone calls to the insurance company to verify your benefits. We make sure our care plan is written to support the policy requirements. So all these things, none of your competition is saying this. And then we do bi-weekly submission of the paperwork on your behalf to take out all the hassle away from you. All right, so I want to give you some examples. Again, putting my mouth where my money where my mouth is. And so this is something where I actually have an ongoing magazine ad and I don't do this in all my markets, but this is an ad. This is a VIP magazine that everybody in Murfreesboro reads. This is a standard ad that I have going every single month. It's a monthly magazine. All right. So just so you can see, we're positioning ourselves as the long-term, but we're actually calling out, hey, do you have a long-term care insurance? And then what we're going to help you understand. This is something that we've partnered with a very affluent independent living community, retirement community, any of those kinds of referral sources and partners that you have out there. All right, so this is a program we're inviting people and their families. We always say, bring your kids, help them to know what amazing benefit you have. This is a program that we're doing at a church coming up, actually November 12th. And so we've done a direct mail to draw out policyholders in our community. Come to this church and learn everything that you can. And I'm telling you, I literally expect from these campaigns that we're doing that I'm going to probably add on at least another $250,000 in revenue in my last quarter. So that's the way we use that to drive your business. Marketing your expertise to your referral sources. This is a program that I did virtually that we're saying, hey, healthcare professionals, this is a guide to help you understand long-term care insurance, help your patients tap into this amazing source. And then I offered a CEU for that. All right. So this is just, again, positioning yourself as an expert. So be intentional. There's lots of opportunity. Learn as much as you can. And you're going to see it. You're going to have the same kind of sales revenue slide that I've got. All right. I'm going to turn it back to you, Julio. Oh, you're muted. How did I do time-wise? Woo.
You did fantastic. You did that right on the money. We have time to get through these survey questions, and there's actually a couple of folks that have some questions. Maybe we have time to answer those as well. So first things first, do you think tapping into long-term care insurance would help you grow your business? The only right answer to that question is yes. So I expect everyone to raise their hand and go yes to that one. Fantastic. All right. So we got 66 out of 67 said yes.
By the
Perfect.
way, I did want to say this just on this point. And the people that say no, they might be thinking, well, I'm in a very low income area. That's understandable. That's understandable. But again, I learned that there are 23,000 just Genworth policyholders. They're more than you might think. And if you are predominantly say a Medicare operation and you've always wanted to go private pay, hang your hat on long-term care. This is a great way to just really get out there and expand your horizons. And we hear a lot of that saying, well, I really want to grow my private pay. Just do a couple seminars on long-term care. Great way to get some private pay business or some.
Good advice, Debbie. That's really good advice. And I can say that based on the geographic distribution of our clients that use long-term care insurance, we don't see any areas where they're not doing long-term care insurance. You'll be surprised what you find out there. So moving on to survey question number 3, we've got, are you interested in attending a masterclass on long-term care insurance and using it to grow your business? I think the information that Debbie's going to provide in a class like this would be well worth anyone's time. As a matter of fact, I will probably attend the masterclass too. And I
It was
don't
a
run an
lot.
agency.
That was a lot to cover, and you're only seeing about 4 or 5 of the long-term care slides that I do when I'm meeting with policyholders. But when they come in and hear for themselves, oh my gosh, all these people that have paid all these years die before they're like, I don't want that to be me. We literally sign them up for assessments right there on the spot.
We actually had that happen, not time for a story, but we actually had that happen with a relative of mine that passed away 2 years ago. We didn't file because it was a 100-day elimination period. And if we had, we would have gotten at least maybe 6 months of coverage. So it's definitely vital that you don't wait and cover. So the answer was overwhelmingly yes on question survey number 3. Let's go to survey question number 4.
Great, good to know. So we'll target you when we've got the program ready to launch.
I have people ask me, Debbie, every week they ask myself and my team, they ask us, where can they learn more about long-term care insurance? So are you interested in more information about Care Time can help you manage your agency and how 52 Weeks Marketing can help you build referral partnerships in your community? We would love to help. For my part, we have an enormous amount of our business is long-term care insurance. I'd say at least 70% of our client base uses it. And they are very happy with some of the features that we have that allow you to do that effectively and efficiently. And Debbie, if you'd like to share on that.
That's awesome. One of the things that, part of our 52 weeks marketing program is branded collateral that gets you in the door and gives you a business reason to be there. This is an amazing topic, but on all your branded materials, you can have on there long-term care advocacy or the long-term care experts. Like we can brand you and help you with this. And again, a lot of the materials that we are providing gives you a huge opportunity to get the conversation going. And we actually have some slides also that we provide to our users, to our clients, to be, like for me yesterday, doing this little presentation to these social workers. I literally had a 20-minute face-to-face, no slides today with a home health and hospice company. And I brought this up and I talked about long-term care advocacy. And I'm telling you, they had never heard anything like it. When I shared the statistics about, most people died, they were like, that's not right. So they want to pass on that information. So again, it just gets you in the door, opens up the opportunity to have these conversations. And it shows how you are there providing solutions to their patients who have problems. All right. And that's what this is all about. It's really positioning you as the expert. You're not just there to drop off cookies. You're there to help them manage their patients, keep them out of the hospital.
Absolutely. And when you tell a family that's been paying into a long-term care insurance policy for years, use that policy. You're not doing anyone a favor by not using the policy. Use your benefits 100%. So we have 1 more minute, and I'm going to go on and ask one question I think is relevant. Do you need to carry an active insurance license to review and advise? What's your answer on that, Debbie?
No, you don't. And as a matter of fact, when you get the if you are confident enough to get the insurance company on the phone, they're going to give you all the information. It's just a matter of asking all the questions that are going to help you uncover exactly what is in the policy. So it's amazing how even insurance, we just did one of these verification calls with a mother and a daughter, and the daughter's been selling insurance forever. And the things we uncover, she had no idea. She goes, this is going to make me a better agent because I'm going to help them really understand the benefits down the road, right? You're going to thank me. Your older self is going to thank me because this is what I've just learned with my mom and here. And she said, I would never have known to ask that. So and this is part of the things that we'll be offering in the master class is to better understand what are some of those things that you want to review.
Perfect. And there's a lot of questions coming up. Here's one that I think is relevant for you, Debbie. And apologies to those. I can't get to all of your questions. This person says they're actually from Canada. So why I'm asking, because I know where you're from. And they want to know if there's anything like that in Canada.
I'm not sure about long-term care insurance policies in Canada. I would imagine that there are, which would be hugely beneficial considering the fact that I know how Canadians are. They don't want to pay for anything. They expect the government to pay for everything. And, here's something, from a Canadian perspective. And by the way, the government home care program is inadequate. Like they might get 4 hours a week. I mean, it's ridiculous. So they've got to augment that. And that could be your conversation is like, you look, yes, the government's going to pay for this amount of care, but your mom needs 8 hours a day.
Right.
Let's tap into this long-term care insurance. So I would imagine there are policies in Canada just like there are here. I left Canada before I was in this business, so it wasn't something that I actually explored.
Perfect. Well, thank you so much, folks. That is the end of our time. Debbie, as always, fantastic presentation. More information than I can absorb today at one time. I want to thank all of those who attended today. 109 of you, when all was said and done, by far
Wow.
the best webinar from attendance we've ever done.
Fantastic.
So we thank you for doing that. And please come back and see us on November 13th for our next one. We'll send out the invites. Everyone, good luck out there. Go get your revenue. Great luck in your business. Thank you so much. Debbie, it's always great to see you. Have a great afternoon.
Thanks, Julio. Bye, everyone.
Bye, everyone.